Hello, fellow instructors. I am Karen Colleen, and I've been asked to give you an in-service on what speech-language pathology is all about. I know that most of you are aware that we work with articulation disorders, but there's so much more. I also want you to know that we are a classroom resource for you. Not only can we work with students on articulation, but we can work with you on curriculum development and classroom observation, where we could come in and maybe observe a student and identify things that can help you for their academic success in the classroom. Other services that we offer, or other areas that we work with, are language. So we work with the receptive and expressive parts of language, and that can help a student in the classroom. We work with pragmatic, so that's the social aspect of communication, and many students sometimes struggle with this, and this can be an issue in the classroom and also in their social life at school. We can work with that. We also can do referral services. So if a person is needing, maybe we did a sound hearing evaluation, and they might need more in-depth evaluation, so we can do referral services for hearing or any medical thing that a student may need. Other things that we do, we also work with swallowing and voice disorders. Now, swallowing typically isn't in the schools as much, but should that be an issue, we could work with a student with that, and voice disorders as well. Trying to think. The other thing that you might be interested in is early intervention. So the earlier you identify a student, the better. And so we can work with preschool teachers or students that you may have concerns about at an early age. We can maybe do some evaluation on that part and maybe get some things in order to work with that student. Now, one of the main things that I think you're aware that we work with is assessment. And assessment is where we have diagnostic tools that we can use to identify areas that a student may need work on in phonology, language, or voice, or any type of communication disorder. And this helps us and you strategize on how to help students. So kind of as an overall summary of some things that we can do are assessment. We can work with students with early intervention. We can work with students with curriculum and technical assistance for you. Classroom observation. We can also work with fluency, referral services, swallowing disorders. The main take home is that I want you to know that we are a resource for you. The other thing that I want you to know is that I've compiled a brochure for you, so don't feel that you have to remember all this. You certainly can look at the brochure, and I'm always around if you have any questions. Thank you.